Question bank in the Prepladder app is very detailed. The solutions are also very detailed and they're accurate. So that is what is good about the app. And when you're reading Harrison's, sometimes you may have some lacks in the concept because Harrison's doesn't cover everything.
Hi guys, this is Dr. Marwah and gives me immense pleasure to introduce today to you Dr. Abhishek Kulkarni, who scored an awesome rank 2 in NEET SS preparation. Heartiest congratulations, Doctor.
Thank you, sir. Thanks a lot.
Doc, can you introduce about your preparation strategy?
So hello, I'm Dr. Abhishek, and I've done my UG as well as PG in MD Medicine from Lokmanya Tilak Municipal Medical College and General Hospital, Sion, Mumbai. And basically, we were the COVID batch when we joined. We were in our PG preparation batch of 2020. So we saw the second wave as well as the third wave. We were at home when the lockdown was imposed. So COVID definitely had a great and a negative and a slightly positive also impact on our preparation for NEET SS examination. Uh, to be very frank, I don't think I really cared about the NEET SS examination or getting admission in any super specialty course when I joined MD Medicine because the love of medicine, general medicine as a subject, is what pulled me towards it and drove me to choose it as a career in my post graduation. So the basic thing was in first year, I'll be very frank, I did not read much at all. एंड जितना कुछ बचा कुछ टाइम रहता था हमारे पास हम लोग सो लेते थे बिकॉज वी बेसिकली हैड ओनली 3 to 4 hours to sleep, get rest. Sometimes we used to skip meals in order to get some more sleep, and that that had a negative impact on our health as well. But by when our third year started, since you know sir, हमारा batch unlucky था. We had a first year of about 1 year and 8 months. We didn't have any juniors because the NEET PG was delayed, as you well know. So we were directly pushed into becoming third years chief registrars straight out of first year, having no experience and no academic knowledge or an academic background, right, to treat patients. So all we had was our guides and our teachers who were, guiding us and japping us to uh, when we used to make mistakes and all that. So yeah.
When did you start actually using Prepladder app for your preparation?
So, sir, I started using Prepladder in around 3.5, 4 months ago, before NEET SS examination. That's how late I started, and I feel ashamed to say this because this is not what you should do. Because every day you're learning medicine is an
Not with
opportunity,
a
and
rank fever.
then you should, that's a mistake I made because even when COVID was over, I agree that I had time to study, but I did not study. Call it the lassitude of residency or call it the inertia of not studying for about 1.5 year. But I did make some mistakes at the initial point of time where I should have been more upfront and proactive regarding my preparation and regarding my goals as a doctor and as an academician as well. So uh, I started late in around February, I think, is when I started reading Harrison's properly. And what I did was I used to read a topic and then solve the question bank module concerning that topic. That's how I started my preparation, and that's what got me back on track.
So actually, my main query would be, how would the actual questions in the Prepladder app that you were attempting,
Yes,
were
sir.
they of the same kind that you actually got in the exam, or was it different? What exactly were the high points that you noticed while giving or attempting MCQs from the Prepladder app?
Question bank in the Prepladder app is very detailed. The solutions are also very detailed and they're accurate. So that is what is good about the app. And when you're reading Harrison's, sometimes you may have some lacks in the concept because Harrison's doesn't cover everything related to a topic. And as Sir is a practicing physician, he very well knows that Harrison's doesn't teach you everything that you need to know about how to actually treat a patient. So they say Lasix is the
Situation.
treatment for heart failure, but how much? How much to give? What if the patient has a BP of say 90/60? What to do now? So there, I think Harrison's also fails. So the advantage of the Prepladder app is that it is detailed. It takes into account many other sources like up to date, like online resources, like Brownworlds, like super specialty level textbooks which cover these topics specifically. So uh, that helps you get a better edge in solving these MCQs.
So, were you any
Uh,
bookmarking any questions like the ones that went
yes,
wrong or
yes,
the ones?
definitely. Because there are some high-end topics like criteria, sub-criteria, some, let's say, numerical related questions like suppose what is the criteria of pulmonary artery hypertension? It's a simple example, but suppose the right heart catheterization criteria of pulmonary artery. So there are some nitty-gritties to it. So that those you may not remember for a long time. So you need some bookmarks. You need some things which you can revise very quickly before the exam as well as before, let's say, some GTs, which I used to do.
Okay, so do you use, I mean, lots of time we bookmark so many questions, but we don't go through them again. They keep on remaining saved in our account.
Yes, yes,
So, I mean,
yes, yes,
how did you overcome that inertia of like, we have the tendency to save them to device, we don't look at them again. So, how
yes.
did you go about handling that?
So once the way I handled it is once I think I know it, I know the topic, I used to delete the bookmarks because they won't serve anything other than to add the burden of more topics to
Mm.
revise, right? So there are some topics
Yeah.
which we may not see in our daily clinical practice. There are some cases which we may not see. So those are the things. I'm speaking as a resident myself. So those are the things that we are more likely to forget, I believe. So I don't think any medicine resident worth his or her salt will forget the management of heart failure or will forget the management of an MI or management of a stroke, but may forget the management of myasthenic crisis. If he has not seen, if he has not been in a good institute which has adequate exposure to these kind of cases. So these are the things I think we need to focus on. And these are very variable because I've had the good fortune to work in a very good institute. So I've seen a plethora of cases, but others may not be so lucky. So that
True.
needs to be individualized, is what I feel.
So, Doc, like, let me say 1 week before the exam, what was your approach? Do you like do only MCQs or did you read theory or you just gave up and said, I am so well prepared that I'm gonna score in a single digit rank?
Never, sir. That is never the case. That is never the case. 1 week before the exam, or let's say I had a 10-day strategy in which I had marked a few points beforehand, like oncology in Harrison's, which is very neglected because
Mhm.
I'll be frank, our onco setup is not that good, but we have a good caseload and a good management and a good setup for nephrology and rheumatology. So I don't really need to focus on those aspects, but I need to revise onco. So I knew this beforehand that what are my weak topics. Like in our setup, um, what we do is for in case of inflammatory bowel disease, what the best we can do is diagnose, but then gastroenterology wants to take them transferred for treatment. So we have never actually given biologics to these patients and monitored these patients on how to do it. So I didn't really know what doses of biologics are given and what are the precautions you need to take. Like for tofacitinib, you need to give Shingrix vaccine beforehand. I didn't really know about these things until I started attending the rheumatology OPD. Of course, then I found out that these are the case. So 10 days before the exam, I made a point to read every table from Harrison's, and especially from topics like oncology and gastroenterology, where there are a lot of criterias and sub criterias. There are a lot of values to be remembered. There are a lot of nitty gritties and fine points to each and every topic. So that's what I did, and then I had some bookmarks of the question bank, and I had bookmarked some difficult questions from the Prepladder GTs as well, and some other
Okay.
resources like Up to Date. We have an institutional access of Up to
Mhm.
Date, so use that as well.
So, Doc, in the end, any tips and any messages for the future aspirants when they should start? And I mean, three main core messages that you would like to give to them as a
Okay,
senior.
okay. So as a senior, I'll say, first thing, don't be lazy. Read something every day. At least try to make it a point to read something. I know your residencies are very heavy, and you'll get tired, and you will say, "यार छोड़ दे, कौन पढ़ेगा? सो लेते, 4 ही घंटा मिला है
Mhm.
सोने को." But just read something. At 3 a.m. when you're writing orders for a patient, and staff comes to you and says, "Sir, this patient is breathless. What should I do?" You need to do something, because otherwise the patient will die. And the second point is that we are not here to crack exams. We are here to treat patients, and we are here to give the best care that we can possibly give to the patient. And number three is that uh, don't get stressed. Uh, this is not, you're going to get an MD medicine degree anyway. And
Yep.
this is not something like ये नहीं हुआ तो मेरा कुछ नहीं होगा जिंदगी में, because basically a physician is always and always will be in demand. That's all the three messages I want to
बिल्कुल.
give.
Great,
Yeah,
great, great.
yeah,
So, Doc, it's been really, really nice talking to you. And
yeah.
I mean, you have given very important
You as well,
messages,
sir.
especially with respect to patient care. And I mean, the broader perspective is I think we need to have a broader outlook about how to go about
Yes,
life.
sir.
And then this is a very myopic
Yes,
view
sir.
that exam निकालना मतलब हो जाता है. I think that's a
Yes.
part and parcel of life. When we get into the grind, then one day obviously we'll be able to overcome this, and we are mentally adapted
Mm,
to this. And if we are, I think
mm,
as doctors, I can say that we are able to adapt very fast to any kind of
yes.
adverse situation, and we're able to
Mm,
overcome it. So, Doc, it's been really,
mm,
really nice talking to you and listening
yes,
to
sir.
all your uh, awesome journey. I mean, with a limited time that you had at your disposal, you used a excellent strategy, I would say. And all
Mm-hmm.
I can say is to compliment you that had you more time, I mean, I mean, I I cannot say that what can be a better rank than this, but I think that you have done a phenomenal job. And my
Thank you
heartiest
so much.
congratulations to you for
Thank you
your
very
future.
much, sir. Thank you very much, sir. Yeah.
God bless. God bless. Doc. Take care. Bye bye.
Thanks.